With the population estimated at 25 million inhabitants, Cameroon in Central Africa covers a little more than 475,000 kilometers square. With a semi-arid climate in the north, the rest of the country is wet and rainy. Cameroon's main export resources are petrol, aluminium, wood, cocoa, coffee, cotton, and bananas. Rich in natural resources, the country is, however, affected by 3 humanitarian crises over 3 geographic zones. The crisis in the Lake Chad Basin in the extreme north, the refugee crisis with refugees from Central Africa in the eastern part of the country, and the crisis in the northwest and southwest. The consequences? More than 1 million people are in forced displacement and 4,300,000 others are in need of humanitarian assistance, or 1 person out of 5. The women and the children are the most vulnerable.
Cameroon continues to be affected by several crises. There has been 3 different humanitarian crises. Here we are in the extreme north, so we are still suffering the consequences of the Boko Haram crisis, which has brought us not only refugees from Nigeria, but there are also many displaced persons who live within the country. So the crisis is still ongoing. Even if there aren't as many attacks, there is still a very important impact on the crisis. And in fact, just recently, one part in the extreme north took on 35,000 refugees after an attack in Nigeria. So it's a crisis that is still very much alive here. In the east, we have the impact of the crisis in Central Africa, with refugees who have arrived, which is there too a heavy load for the country and the host community. And the last year we witnessed the development of a third crisis, which is the crisis in the northwest-southwest region, which is today probably the most active and the most violent crisis, and where we estimate that there are 500,000 displaced. And in this case, we have Cameroonians who have gone to Nigeria. So we estimate that there are 9 regions out of 10 that are affected by one of these crises, which is huge. Since December 2013, the area in the extreme north of Cameroon is engulfed in a complex humanitarian crisis worsened in 2014 by the pressure of the Islamist sect Boko Haram. The departments of Logon and Chari, of Mayo-Sava, of Mayo-Tsanaga, located at the borders of Chad and Nigeria, record massive arrivals of populations who have fled the brutalities of Boko Haram. These populations find refuge with families in the area who are already poor, which reduces even more the livelihood of these communities and increases their vulnerability. Some towns have doubled, even trebled in size with the arrival of the displaced. So there have been a lot of effort to bring some unity to this coexistence. So we can congratulate these populations because quite often in the past we have seen a lot of tension between the displaced populations and the host population. But in Cameroon, honestly, these populations continue after 4 or 5 years to show an exceptional generosity in welcoming the populations. And on the other hand, the objective for us is to try and help more and more with a community approach, which means that when we give our support, it benefits not only the refugees or the displaced, but it also benefits the host population. The data reveal that more than half of the refugees and internally displaced are children and women. Their living conditions are often precarious. Even if some have the chance to be accommodated by host populations, more than 40% live in temporary hired shelters. We are in Zamai camp for internally displaced in the department of Mayo-Tsanaga. Here, nearly 4,000 Cameroonians live under these tents set up by the HCR, the United Nations High Commissariat for Refugees. These populations have different stories, yet they have one point in common, and that is the need for a secure place to live
to escape the bloody incursions from the Nigerian Islamist sect. Falta Hasheket, 34 years, married and mother of 7 children, has lived here for a year and a half. She has also had to flee in order to save her family. Her village, Modogo, located close to the Nigerian border, was attacked by Boko Haram. Boko Haram kidnapped us in Modogo and then took us to another village. Because of the sufferance we endured over there, we escaped and fled to Mozogo, a department of Mayo in Kanaga. That's where the authorities got organized to send us to the camp in Zame. That is how we found ourselves here. We got kidnapped, and me and my children, we were taken to a place that I didn't even know of. We were able to run away before they tried to kill us. In spite of a tendency indicating recovery since 2016, the conditions which prevail in the zones of origin still do not enable a worthy, secure and durable rehabilitation. Violence persists, and the access to basic social services such as health centres, drinking water points and schools remained limited. The UNFPA, the United Nations Fund for Populations, the UNHCR and UN Women, in collaboration with the Cameroonian authorities, have brought a multi-sectorial and integrated assistance which covers prevention, medical care, legal assistance, security and psychosocial aid to refugees, the internally displaced and the host populations of Cameroon. The UNFPA, who is involved in the fight against gender-based violence, has brought in medical care and has improved the access to reproductive health services for the internally displaced and refugees, in particular in the extreme north of Cameroon, in the camp of Minawao, in the department of Mayo-Tsanaga.
Le Fonds des Nations Unies pour la Population au Cameroun poursuit.
The United Nations Populations Fund in Cameroon follows the 3 transforming objectives of our strategic plan, which has the aim of achieving 0 unsatisfied need in family planning, 0 avoidable maternal deaths, 0 gender-based violence toward women, and harmful practices towards women and girls. The strategy is written down in our 2018-2020 program, which is in line with our national priorities and the development framework of the United Nations that was adopted for this and that covers the 2018-2020 period. So in terms of the results that we are aiming at, the strategic points are aligned with the access to integrated services for reproductive health and family planning. Secondly, it concerns adolescents and youth. And thirdly, the availability of viable data to enable to facilitate decision-making and in particular to ensure the monitoring of the implementation of the Millennium Goals. This camp is the largest of the country. The 57,000 people who live there have fled the brutalities of the Islamist sect Boko Haram. Here, in 2013, approximately 70 births were recorded per week, a factor of overpopulation for this camp already vulnerable because of this insufficiency of financial resources. Some 60 community relays were formed. By groups of 2, they go to the refugees to encourage them to follow family planning. The objective? To reverse the birth tendency and to reduce maternal mortality.
Before we start counseling, we make both of the male and female, which is husband and wife. We start advising how to reduce or how to take a planned family, which is we give them the consequence or the advantage and disadvantage of the planned family. Example, you see one wife, she get a baby, she get a pregnancy, and even to go to school, they can't pay the school fees. As far as we are not paying the school fees in refugee camp in Minawa, which is free education. And we tell them that even if you go to the hospital to take in a planned family, it's free. It's not 0 franc. They're not taking money from you. After we finish with them, they will take a method which they choose, whether it's Jadel, Equilibre, or what else.
Family planning is very advantageous. I am very happy because before I used to suffer during my pregnancies every year. Now that I follow family planning, my children grow up well. My pregnancies are spaced, the children and I are in good health. That is why I thank the UNFPA as well as the Health Relay and midwives.
Still, in the department of Mayo Tsanaga, the UNFPA's assistance of refugees and internally displaced is also visible with the hospital of reference in the district of Mokolo. Planned to accommodate 200,000 inhabitants, the surge of refugees has led to an increase of the number of services since 2013. From 2012 to 2014, for example, the number of caesareans carried out in a month went from 6 to 20. The UNFPA, who fights for a world where each pregnancy is wanted, each childbirth is without danger, and the potential of the youth is reached, has supported the supply of reproductive and sexual health services through the provision of childbirth kits, caesareans, beds, heating tables for the newborn, and contraception means for women and girls. This support helps save the lives of the mothers and the children. It's the case for Christina Yakata, who soon will undergo a caesarean. This refugee from the Minawao camp was taken 2 weeks ago to the hospital of Mokolo due to complications related to her pregnancy.
After an echography, we realized that she has a placenta previa. What it means is that the placenta is not placed where it should, and that is what has provoked the bleedings. So she was given mediation to try and stop the bleeding. The bleeding stopped, but we decided to keep the lady at the hospital until she reached 34 weeks of pregnancy. When she lived in Nigeria, she had already had 6 pregnancies. This was the 7th. She had had 3 miscarriages and 3 childbirths. From the 3 children she gave life to, only 1 is left. So we can say that this child is rather precious.
There was an attack in our region in Nigeria, and after that we fled. Over there, some had their throats cut, others were shot, but we were still able to run away to avoid this massacre. As we were fleeing, we were taken to the camp in Ninawa. Today I'm here for health reasons. I was bleeding a lot in the Ninyawa camp, so I was transferred here in the reference hospital in Mokolo, and I'm cared for and I'm following a treatment. I really appreciate the services here.
That day, working on the ground, we met Cameroon's Minister for Health. He is here to make contact with the medical authorities of the department's reference hospital. Here, various humanitarian partners of the United Nations system support the medical staff.
We work now with secure partners like the UNFPA and others. I would like us all to sit at the same table, all the partners, so that we can try and see together who does what in the sector of health. The objective is to optimize each one's interventions in this sector. And one point we have felt is that we are just here next to each other and we are not doing enough in terms of optimizing the resources that we have with this partner. So in view of being cohesive and harmonized, we will organize a high-level workshop on the ground in view of this.
The extent of gender-based violence on refugees, internally displaced and host communities from the areas in the extreme north remains still largely ignored. And that is because of the absence of reliable data on the phenomenon, because of the taboos, the fear of stigmatization, the social standards and the relations of power that subject women to male domination. Between January and August 2016, 353 cases of gender-based violence were reported by the medical structures in the extreme north. To face the problem, the UNFPA initiated the concept of safe space for the survivors of violences. In this house, within the hospital of Mokolo, the survivors of violence will be able to benefit from medical care but also security services, legal support, and psychosocial support. Moreover, one service called SRA, which stands for Reproductive Health for Teenagers, was set up to advise young people.
Tout jeune qui entre, nous devons lui parler du planning familial.
We need to talk to all the youth amongst us about family planning. Some people don't even know there is family planning to avoid unwanted pregnancies and sexually transmitted diseases. We present to them the methods. We explain all these methods, and in some cases they are given appointments to discuss the choice of their method. We are now at the hospital of the district of Mora, in the department of Mayo-Sava. Angèle Atsama, magistrate at the Mora courthouse, who works with the director of the hospital and the focal point for gender-based violence, has confided that she has worked on at least 15 cases of rape, which have led to convictions going from 10 to 15 years of imprisonment. We face physical violence, psychological violence. There are also cases of denial of resources and opportunities and services. There are also cases of sexual assaults. And care is given by referring cases here. So when a case has been referred to us, the case is referred through a report, a formal complaint. Then the care is provided and we evaluate and identify the problem. Because a person will come to us and say, I have suffered such and such a problem. We, the experts, we define the problem that we need to resolve, and it's done in a professional way according to the ethics and requirements of the law. Within the context of the fight against youth violent extremism, we make our way to the canton of Mozogo, which is located 35 kilometers from the border with Nigeria. Here we meet Lamido Abba Mahama Shetima. He's a political and spiritual leader in a Muslim territory in this zone of Cameroon. His Majesty, as he is called, is in the forefront of the fight against youth radicalization.
The parents are poor and the border zone is abandoned. Sometimes the small children leave school to go to the big cities in Nigeria. So when they find an organization or person who gives them hope, they will go there. What makes them go to these types of organizations is hope. What is their hope? Well, it is to get married, to have a motorbike, to have some money. This is what motivates individuals. The well-being of others is not a concern. That is what has been promised to them and what has encouraged them to enter these groups. But when they get there, they find the opposite of what has been promised to them. But then it's too late and they don't have the opportunity to turn back.
In view of the implementation of the project for youth resiliency to violent extremism, the Lamido of Mozogo has granted some land. The training project piloted by the UNFPA and its partners aims at enabling vulnerable youth in this zone of Cameroon to acquire life skills so that they can achieve a socio-economic insertion. We meet some of these youth on the grounds granted by the Lamido. This project has changed my life because we were always attacked by the Boko Haram or Sufri. This activity enables me to have hope for the future. The project helps us in relation to our families and it enables us to move forward.
It's good for us to work like this in agriculture, because when you don't have anything, you will end up going and doing bad things. But when you have money and a job, you will forget the bad things. You won't think about doing them. We have these people who cultivate onion. They have cultivated this field and they will probably sell it all a good price, which will enable them to pre-launch the activity next year. On the other hand, there are other youths who have chosen to get involved in storing cereals. They bought the cereal at a good time in December, January, and they will sell it in July and August when the prices will be higher. They work in another field too, in recharging batteries. for mobile phones. For example, those who live in Mokastamer, where there is no electricity over there, yet people have phones. So it's a financially interesting activity.
Les gens ont pourtant des téléphones et c'est une activité rentable.
We continue our trip through the extreme northern area of Cameroon to get to Tokombere, a commune of the department of Mayo-Sava near the Nigerian border. On our arrival, we meet the director of the community radio, Semence de Vie, meaning seed of life, who is in the middle of recording the news. The radio receives support from various institutions, including the UNFPA, to broadcast programs in 12 languages.
So we have radio spots that fight the rejection of modern schools, because that is what Boko Haram means, that you mustn't accept Western education. But we send our messages that says that the Quran, even the Quran wants that children be educated. The Quran says that you should go even to China to find knowledge. So we need to take these declarations that are in the Quran to say that this is in reality with what the Quran teaches, so that we don't get duped by knowledge that comes from mere people. We need to entrust what the Quran says, and the Quran is not against modern education. For example, on the topic of hatred, we send out spots on hatred. We need to show that as long as there is hatred, we will not live in peace. We lose our parents and brothers, our families, so we need to fight hatred with love. So these are the kinds of themes we cover. There is also, for example, refusing to be the instruments of persons that we don't know. So these are things like the education of young girls and other things that we cover here. And we know that we are touching people because we do receive feedback from people who say that what we have said has really touched us, and we are committed to turn our back to these kind of practices. And we know that we are touching people because we do receive feedback from people who say that what you have said has really touched us, and we are committed to turn our back to these kinds of practices. And that encourages us because we know that, and this encourages us because we know then that people are following and that it changes hearts.
The government of Cameroon makes efforts on a daily basis to help the populations of the zones in crisis, but the needs are increasing significantly and becoming more urgent than ever. Also, a humanitarian response plan was launched on February 20th, 2019 by way of the agencies of the United Nations System's holistic and global response to support 2,300,000 people in Cameroon. It's within this framework that the UNFPA Regional Director for Western and Central Africa went to the extreme northern part of the country, where he visited the Multipurpose Center for the Promotion of Youth in Zamaï, a structure supported by the UNFPA, which reports to the Ministry for Youth and Civic Education. In Zamaï, the concerns relate to poverty, the increased vulnerability of the populations in general, the youth in particular, and more specifically, the girls. On this site, the UNFPA Regional Director for Western and Central Africa, accompanied by seniors from the regional office, as well as technical and financial partners, were able to see the achievements of the youth who have benefited from a training in order to reinforce their resilience and their empowerment. After this visit, he went to the internal refugee camp of Zamaï.
Les besoins sont énormes et nous devons en tout cas.
The needs are great, and we have to double our efforts and make sure that the lives of these young boys who should be in classrooms today, we must create a future for these youth, because otherwise it will be other and greater difficulties that we will have in the future.
J'espère que la communauté internationale.
So I hope the international community measures accurately the challenge that the country faces.
This visit of the UNFPA Regional Director for Western and Central Africa was also the occasion to review the cooperation with the Cameroonian authorities.
Nous avons évoqué la question un peu du financement de la santé.
We have talked about financing health, which should benefit from a particular attention to match the fiscal effort to finance health with the objective of Abuja, such as agreed by the African countries. On this topic, we have also talked about the problem of maternal mortality in Cameroon, which is relatively high and which is already subject of particular attention from the most of the Cameroonian authorities.
La question de la mortalité maternelle, donc au Cameroun, qui est relativement élevé et d'ailleurs qui fait déjà l'objet d'une attention particulière de la part
And we have
des
expressed
autorités,
our wish and our
de la part des
availability
autorités,
to strengthen our current support
et nous
to change
avons
the
exprimé
tendency,
notre
because as
souhait,
you know,
notre
we need to make
disponibilité
sure that
à
no woman
renforcer
dies giving
l'accompagnement
birth.
aux efforts en cours pour infléchir les tendances, parce que, comme vous le savez, nous devons faire en sorte qu'aucune femme ne meure en donnant la vie. Nous avons également discuté de la question de la situation humanitaire.
We have also talked about the weight of the humanitarian situation in the extreme north part of the country and how we can reinforce our support to the current action under the leadership of the government, and we have reiterated our principles that we are behind the action of the government and we want to help them meet their own aspirations.
Gouvernement, donc les aider dans la réalisation de leurs propres aspirations.
During this humanitarian visit in Cameroon, a plea was carried out in order to have the country adhere to the SWED initiative, the Sahel Women Empowerment and Demographic Dividend Program. 7 countries today are members of the SWED: Burkina Faso, Ivory Coast, Mali, Niger, Chad, Mauritania and Benin. By adhering to it, Cameroon could be given additional financings to contribute to raise the resources towards the field of health. Likewise, it could find opportunities for youth, including those who are in the extreme northern part of the country.